Hello, everyone, and welcome to today's presentation about optimizing a data migration with an assessment. We are excited to share this material with you as part of Galen's webcast series. As Logan mentioned, before we get started, I want to address a couple housekeeping items. First, all phone lines are muted to prevent any interruptions during the presentation. If you have a question at any point during the presentation or afterwards, please ask it by using the Q&A functions within the WebEx. There should be a button in the top right of your WebEx screen that you can click to open the Q&A panel. Enter your questions into the text box at the bottom of the panel and make sure it is directed to all panelists. We will answer any questions at the end of the presentation. If we don't get a chance to answer your questions today, we'll follow up with an answer within a few days. Finally, we'll be posting the slides and Q&A from today's presentation on Galen's public wiki page, wiki.galenhealthcare.com. Today's materials can be accessed by following the Galen webcast documents link from the main page of the wiki. The materials will be posted within the next 3 to 5 days. We're also recording today's presentation, and we'll include a link to the recording on our wiki as well. Today's presenters will be me, Tyler Swatchy, and one of my esteemed colleagues, Kayvon Kaboli. I serve as the lead technical consultant for Galen and have over 12 years of healthcare IT experience, concentrating primarily on data migrations, integrations, and reporting. Kayvon is a consultant from our professional services team. He holds a master's degree in public health and has excelled as a program manager for our data migrations team. Today, we'll be discussing how an assessment can help optimize a data migration. We recently completed an assessment for an organization prior to performing a data migration for them, and we wanted to share some of our findings from this approach. First, we will begin with a review of a typical data migration project and review some of the details of the project that we will be referencing throughout the presentation today. Next, we'll get into some of the details of the assessment, review our process a little bit, and discuss some of our findings and recommendations. We'll also review the benefits an assessment has on a data migration project and why an organization should make an assessment part of their data migration plans. Finally, we'll review any questions that the audience may have. As I mentioned before, please enter any questions during or after the presentation in the QA section of the WebEx. Over the past few years, Galen has performed hundreds of data migrations from various EHR systems in both the ambulatory and inpatient environments to a handful of EHRs. We've worked with organizations big and small to migrate off of systems such as GE Centricity, ECW, Greenway, NextGen, McKesson, EMDs, Allscripts, and many others. And we've successfully migrated this data into systems such as Epic, Cerner, Allscripts, and Meditech. Generally, the type of data being migrated includes some, if not all, of the most common types of patient and clinical data, which includes demographics, problems, medications, allergies, immunizations, encounters, results, vitals, notes, and scanned images. And in each of these migration projects, at some point, each of the data elements within scope is assessed and a determination is made to migrate the data or not, and if so, in what manner. Sometimes these decisions are made by the client in advance of the migration project kickoff, or even before project scoping based on previous experiences or organizational policies. But many times, we find the data isn't fully assessed until sometime during the course of the migration project. Waiting this long to fully assess the legacy data can be risky. If additional effort is required to remedy or resolve any negative findings from those assessments, then the project may be at risk of not completing on schedule, or the success and quality of the data migration may be compromised. So it is important to perform a thorough assessment prior to kicking off the data migration project, and ideally prior to scoping the project. We recently had an opportunity to work closely with one of our clients to perform an assessment of their legacy systems prior to starting the data migration project. We found this to be extremely beneficial to the client and ultimately to the migration project that followed. Today, we'll review the assessment process, some of our findings from this project, and discuss how an assessment can set the foundation for successful data migration. The migration project that we'll be referring to was performed for a health system that had 3 legacy systems migrating to an existing instance of Epic. The hospital was using Meditech 6.0, and the clinics were using a mix of Meditech LSS and GE Centricity EMR. Prior to the assessment, they had made the decision to migrate all 3 systems together and scheduled to go live for all of them at the same time, known as a Big Bang strategy. And even though they were part of a larger health system that was already on Epic, the group that we were working with had no previous data migration experience. They also had a short timeline in which to complete the data migration project, which was likely due to a result of their lack of migration experience. As some may be aware, a successful data migration project can require months, but they weren't afforded that luxury. And finally, I want to note that the legacy systems in this project were all hosted on premises by the client rather than by the vendor or another third party. This means that we could easily gain access to the systems in order to perform a more thorough assessment. Now we'll discuss some of the details of Galen's approach to the assessment. First and foremost, when performing the assessment, we need to keep in mind the goals of the data migration project. The main goal of any data migration should be to maintain continuity of patient care through the EHR transition, which is a very different goal than those of record retention or data archival. There may also be some client-specific goals, such as the need for a Big Bang go live, as was the case for our reference clients, versus rolling or phase go lives over weeks or months. These goals will drive the assessment and influence many of the decisions that need to be made and the recommendations from the assessment. The goals will also drive the types and level of analysis that need to be performed during the assessment. Once the goals are established, Galen can begin digging into the details of the assessment. Our approach to the assessment is similar to our approach for many of the projects we take on. We use a 2-pronged approach, deploying resources from both our technical services team as well as our professional services team. This allows us to deliver a more complete assessment. There are aspects of the assessment that can only be fully analyzed by someone with technical expertise, and there are other aspects that require the in-depth knowledge of a professional services expert. This approach also allows us to assess certain aspects of the migration project from 2 different angles, providing for a more thorough analysis of the areas that need it. We'll review some examples of this later. Let's look at the technical tasks of the assessment first. First, we'll perform a data analysis for all of the clinical data types. This means digging into the legacy databases and reviewing and analyzing the data in its raw form. This can reveal very different results than just looking at the data from the front end. We also assess the completeness of the data. For each data type, we identify which discrete data elements are available. For example, allergies will always specify an allergen, but does the legacy system include reaction, severity, last assessed date, or any other optional pieces of data? We'll also check to determine any codifications that are associated with the data. This means a couple things. One, does the data contain a national or industry code set that can be leveraged during the migration project? Examples of these are LOINC, ICD-9 or ICD-10, ARCS, NORM, SNOMED, NDC, and CVX codes. If these codings exist, then mapping effort for the migration project can be drastically reduced. Sometimes we can use the codes themselves when importing the data into the target system, removing the need for mapping completely, or sometimes we can use the code to help us map the data to the appropriate target system values. The second thing we look for as it relates to codes is the number of data elements that are linked to dictionaries, as opposed to storing data as free text. This will impact the effort for transforming the data so that it is compatible with the target system. If the legacy system allows for data to be free texted, there will be multiple variations of the same data element. For example, a problem of diabetes could be spelled 10 different ways. This will lead to significantly more mapping effort if the data is being migrated discretely. Next, we look at the storage formats for each of the data elements. This mainly applies to notes and scans, but we determine the format in which they are stored, whether it be RTF, plain text, TIFF, or PDF, or some other format. Are they stored as blobs within the database, or are they external files? Are they stored in proprietary formats? Is the data encrypted? These are the types of things we look for. While we're interrogating the legacy database, we'll also refine our data extract scripts. No matter how many times we've worked with a particular legacy system, the data extracts may still require some tweaking to account for a non-standard workflow or some customization within the legacy system. Being able to address this in the assessment phase of the project really gives us a head start on the migration project that will follow. Finally, once we've got the extract scripts in a good place, we can start accurately summarizing the data mappings that will be required and provide those to our professional services counterparts for their analysis. Speaking of professional services, I will now turn the presentation over to Kayvon so that he can discuss some of the tasks that his team performs.
All right, thank you, Tyler. So as mentioned, I'm now going to run through a few of the items and processes that take place from a professional services standpoint during a typical data migration assessment. So one of the first steps in our assessment process is to develop and deliver a customized discovery questionnaire. And in the questionnaire, oftentimes we ask exploratory questions such as, what version of your legacy system are you currently on? And in that same vein, what ancillary systems are currently used by your organization? So in terms of the ancillary systems, gathering information about what document management systems are you using, and likewise, what radiology and lab vendors are you currently using? Another important facet of the data migration process is knowing whether or not you have any upgrades planned during the data migration. And so this is another question we like to ask, as upgrades can often impact the availability of your EHR or ancillary systems, and in this way, they could also have a large impact on the migration timeline itself. If we don't account for any planned upgrades, these delays could set the project back significantly. So again, knowing about these upgrades in advance is very useful for planning. Another item, as Tyler touched on previously, we also like to understand how the go-live is going to be carried out. So when you go live on your target system, is your organization planning for a big bang go live, or will you be rolling out the new EHR in a piecemeal fashion? So understanding your go live strategy will allow us to devise a cutover plan tailored to your organization's needs. We also like to collect information regarding the facilities involved in the migration, along with the size of these facilities. So are we converting data for an internal medicine practice, or is it a surgical practice? What is the specialty of the facilities that are involved? Are there multiple different specialties involved in the migration? How many physicians or end users use the EHR at this site? Information around these parameters helps us guide the scope of the conversion and gauge the volume of data that may be involved in the migration project. Ultimately, the goal of the questionnaire is to serve as a starting point and to provide a high-level overview for the Galen team by capturing information that will allow for our team to both better understand the configuration of your legacy system, and in that way it will allow us to provide recommendations for the scope of the migration. During the assessment, we also like to review any existing documentation you might have. So if your organization possesses documentation that outlines existing clinical and technical workflows, there's no need for us to reinvent the wheel here. We can simply leverage those materials and use them as research inputs to guide the data migration as well. Another aspect to the data migration assessment process is understanding and reviewing clinical workflows that are carried out in your legacy system. So understanding the documentation methods that are being used for various clinical elements. So for example, if certain items are documented discretely in your legacy EHR versus being written on paper and then finally scanned into your EHR. So knowing what elements are documented in which ways helps the Galen team, again, define the scope and advise on the best methods for converting each of these clinical elements. Just a few more specific examples of things we might investigate are, for example, how are you currently prescribing medications? Chances are at this point in time your organization e-prescribes, but are there any situations where medications are created using paper scripts? Knowing if that's even being a workflow at your facility allows us to make sure that we can capture that information if it's being documented in a different way. Another example is whether or not point-of-care labs are interfacing with your lab information system, or are these point-of-care labs results being entered manually into the EHR. Having this knowledge might impact what is used as the source of the various clinical elements included in the conversion scope. It might make more sense to extract certain lab results from your lab information system and others from your legacy EHR. So again, understanding how these clinical workflows take place in advance allows us to make the determinations necessary, and we can make similar determinations to the ones I just outlined in my examples. Excuse me. The final professional services process that I wanted to talk about a bit today are the ways in which we finalize the data and then provide recommendations regarding the time frame or time span of the data that should be included in the scope of the migration. So one of the ways we analyze data is from a volume versus time perspective. That is, for the data elements that are being considered for the migration, for the previous 1 to 2 years, what is the volume? What about 1 to 3 years or 1 to 5 years? The point is reviewing the volume of data on a year-by-year basis allows us to determine what time frame will capture the most data for conversion from your legacy system to your target system. Maybe when you first went live on your legacy system 5 years ago, there were large amounts of scan data that were loaded, while conversely, the majority of your discretely entered data, such as point-of-care lab results, exists between now and 2 years back. Having this information up front allows us to provide options for you. So in this example, we could suggest converting 5 years of scan data while only converting 2 years of laboratory data. And finally, just one other example, maybe there are certain clinical elements where the full history is useful and necessary for clinicians to practice moving forward on your target EHR. And so these are the types of things an assessment brings to light, and it allows us to prepare for and prepare you for during the data migration. So we perform the analysis to make these types of recommendations and ultimately allow your organization to digest this information and decide what makes the most sense for you. So all of the processes I just discussed culminate in a written assessment. In the written assessment, which we deliver to you, the client, we touch on many different facets of the data migration, a few of which I'm going to briefly talk about now. So first and foremost, as mentioned, we do deliver a written assessment, and in the written assessment, we review our methodology. That is, how we plan and recommend that the various data types be migrated from your legacy system to your target system. So, for example, we would define and explain what the difference between patient-level and encounter-level data is and the implications and methodologies for converting each of these. We also discuss the different data types to help explain recommendations regarding what clinical data types should be included in the scope of the conversion. Maybe it makes more sense to convert all active problems, allergies, and medications, but only a small subset of notes such as operative and procedure reports. And finally, in the methodology section, we provide a review of how the various in-scope clinical elements will be converted. Will they be discretely entered into your legacy system and therefore actionable, or will they be view-only? Sorry, will they be discretely entered into your target system and therefore actionable, or will they be view-only? So again, these are the kinds of information you can expect to find in the methodology section of the written assessment. It's information that ultimately will help you to understand our process and allow you to digest the rest of the information that's being presented in the written assessment. Other items touched on in the written assessment are recommendations surrounding the patient population. So, for example, should data for patients that are deceased be converted? So discussion around scenarios like this. how should you, the client, define a patient population for inclusion in the migration? Does it only make sense to convert data for patients that are still active in your healthcare system? And if so, how should you define the criteria for what constitutes an active patient? In the written assessment, there's also a limitations section. And in this section, we review limitations in terms of what data we may not be able to convert, such as future or standing orders, or any limitations in terms of the level of detail we'll be able to maintain when converting data. And many times these limitations are dependent on how the data is stored in the legacy system. Likewise, there are scenarios where duplication of certain clinical elements may be unavoidable. So, for example, if other practices have been live on the target system, it's possible that certain clinical elements may already have been documented in that system, and they could therefore potentially be duplicated when we convert them from a given legacy system. So these are the types of information we seek to make you aware of in the limitations section. And again, the hope is to provide a global view of the migration process. In the written assessment, we also provide the actual raw data and the findings themselves, so things like usages and volume of the various clinical elements, and then how many, for example, of each of the different types of clinical elements are unique in your legacy system. And then finally, in the written assessment, we also provide information regarding how to prepare your target and your legacy systems for the migration itself. So for your target system, you may need to perform configuration or setup so that it can actually accept the converted data that we're sending in. For a migration to Epic, for example, ensuring that the Care Everywhere patient abstractor interface is set up, that discrete data parsing is enabled, and that the incoming translation tables are set up, for example, is paramount to the migration process. Other items to consider are, for example, what's the best fit for your organization in terms of converting scans? Does on-base work best for your setup, or does a blob server make more sense? Then stepping over to look at the legacy system side, performing tasks such as patient cleanup activities, so verifying and finalizing all results, ensuring that all notes are completed and signed. We tend to recommend preparations like these as oftentimes clients only want to convert data that's been finalized. Another example pertains to the details that are associated with the various in-scope clinical elements and cleaning up erroneous or inaccurate documentation of information in the legacy system. So for example, if through our analysis we notice there are a large number of immunizations where the body site fields actually have the manufacturer information documented, we can provide you with the information you need to go back and clean up those issues prior to the migration, should you choose to do so. And then just a final example, if the data migration is for a hospital, in this section, we like to discuss items such as the inpatient cutover plan. Reviewing items that require further discussion, such as turning off interfaces, and how will inpatient medications and active orders be handled during the cutover process. These are things that we can assist with and discuss. And so that's just a quick look at the types of things we provide in the written assessment. But then just taking a step back, the goal in all of this and all of the assessment processes that I've reviewed today, it's primarily to help your organization devise a migration plan that can be tailored to fit your needs and your goals. So again, that's just a brief look at some of the tasks we perform and the types of information we provide from a professional services perspective. And with that, I'm going to hand things back over to Tyler.
Thanks, Kayvon. So now we'll review some of the parts of the assessment that both of our teams really contribute on together. The first of these is data compatibility and migration feasibility. How compatible is the legacy data with the target EHR? For many of the target systems, data import is handled through processing of HL7 or CCD messages, which is the case for Epic, our reference client in this case. We'll review our findings from the legacy data analysis, and keeping the overall goals of the project in mind, we'll assess what the best method will be for migrating each data element and provide a list of pros and cons. Should immunizations be migrated via CCD or via HL7? What are the pros and cons of either format? We'll also identify any data compatibility gaps that may exist. For example, some systems store results without linking them to an order. However, many systems require an order to be created when importing results. What are the options for resolving this, and what are the pros and cons of those options? We'll also evaluate the formats that the legacy system supports for data extract and assess if they can be leveraged for import into the target system. For example, does the legacy system support a CCD extract? If so, will that CCD deliver the functionality that is required when it's imported into the target system and meet the goals of the data migration project? Many times it won't, in which case the raw data needs to be extracted and transformed into a CCD message prior to being loaded in the target system. In the case of HL7 messages, many systems don't even allow for the bulk extraction of data in HL7 format, in which case we take the same approach as the CCD, extract the data from the legacy database and transform it into HL7. We'll also review the codifications from the legacy system and how compatible they are with the target system. Many systems support common nomenclatures, but they don't all support the same ones. An example of this may be a system uses medicine terms to code their problems, which sometimes can be useful for a migration depending on the target system. But if the target system requires SNOMED codes for their problems, then something will need to be done to resolve this disconnect. Finally, is the migrated data going to fit into the existing or planned workflows in the target system? Ultimately, we want the workflows for the migrated data to be very similar to the workflows for the manually entered data. We'll assess where there may be gaps in the source data that don't allow for the seamlessness and make recommendations. Ideally, the assessment is performed prior to scoping the data migration project, in which case the findings and recommendations from the assessment can be used to help set the scope of the data migration. One of the things we can do during the assessment, and Kayvon touched on this, is to analyze the volume of legacy data and identify the number of additional mappings that would be required to support additional years of adding additional years to the scope. This can help determine how many years of data can be migrated while staying within budget. Kayvon also mentioned the different types of data within a data migration and the classifications of two different categories. Patient-based, which is problems, meds, allergies, and immunizations, or encounter-based, which includes results, vitals, and documents. The assessment, along with some other factors, can help determine which of these data elements should be included in the migration. It will also help determine the best format in which to migrate each data element. As we mentioned earlier, HL7 and CCD are the main formats supported for an EPIC migration. These formats deliver different workflows in EPIC. Data migrated via CCD will require reconciliation or even manual entry before the data becomes part of the patient's chart, whereas data imported via HL7 immediately becomes part of the patient record. Obviously, there are other factors that will influence this decision, such as cleanliness of the legacy data, client preference, any patient overlap between the legacy and target systems, but the assessment can also help make this determination. The assessment can also evaluate the difference between pediatric and adult patients and help determine the impact of having different migration strategies for these types of patients. The final piece of the assessment is the findings and recommendations. When making our recommendations, there are a few things that we want to take into consideration. First, is our recommendation maximizing value for the project while also reducing costs? This is a fine line, but we'll try to meet the objectives of the project in the most cost-efficient way possible, thereby maximizing the ROI for the client. Generally, this means migrating only the data elements that are required for continuity of patient care. We also want to make recommendations that are going to reduce risk for the organization. Unknowns with the legacy data is a huge risk, but that's why you do an assessment prior to the data migration. After the assessment, we'll have a very good understanding of the legacy data and be able to make recommendations that will minimize or even eliminate any risks related to the legacy data. There are potential risks with each of the migration processes as well, and there are higher level project risks too, such as meeting project deadlines that we'll need to consider when making recommendations. We don't want to make a recommendation that is going to put the project at risk of timely completion. As we mentioned earlier, we also want to make recommendations that are going to reduce the impacts to workflows in the target system. The migrated data should seamlessly integrate with existing workflows. Next, we want to minimize or eliminate the amount of manual abstraction that is required. Obviously, if an organization is pursuing a data migration, it's partially because they don't want to invest in manual abstraction. However, there are instances where some manual abstraction may be required. We'll also want to maximize the usability of the migrated data. For example, can results be migrated such that they satisfy health maintenance reminders in the target system? Many times they can if the legacy data is assessed properly. And finally, we have to consider the setting in which the migration is being performed, as Kayvon alluded to earlier, ambulatory or inpatient. Inpatient migrations have some special considerations given that there is no downtime. Our recommendations will account for the nuances of an inpatient migration, such as the need for a special cutover plan and the potential need for manual abstraction of certain data elements for currently admitted patients. Next, we'll review some of the specific findings and recommendations from the project we recently completed. First, we identified that one of the legacy systems allowed for immunizations to be recorded in 2 different ways. Unfortunately, the method used by our client was a less desirable one. There was going to be considerable work needed to be able to preserve the full set of immunization data that was being recorded. Ultimately, the client decided to include immunizations within the scope of the project, but identified only the pieces of immunization data that were critical to the continuity of patient care. We also discovered that the notes that we had access to for data extraction were formatted slightly differently than when the notes were viewed through the legacy application. Identifying this in the assessment gave us plenty of time to apply any formatting changes to try to address the differences, and it also allowed us to set expectations for our client and their providers so there were no surprises at transition. Next, we found that the medication instructions were not stored discretely. This is a frequent finding amongst the legacy EHRs we've worked with, and is typically resolved by applying mappings to the medication in order to transform it into something more useful for the target EHR. One of the positive findings that came from the assessment was that a very high percentage of discrete codable data, problems in medications in particular, contained references to common coding systems. This allowed us to confidently reduce our mapping effort for the migration project. In the last example, we identified many types of vitals being recorded in one of the legacy systems, many of which did not contribute to the continuity of patient care. We recommended removing those from scope, which resulted in less effort for the mapping process, less effort for testing, and less effort for validation. It also meant that there would be less configuration or build required in the target EHR. We've alluded to many of these throughout the presentation, but here are some of the benefits of a legacy system data assessment. First, it is going to help define the scope of the data migration project. The assessment should be performed as early as possible in the process, ideally before the data migration even kicks off. Next, an assessment is going to set up the data migration for a high level of success, and we will yield a higher quality migration project. The assessment will also allow the organization to maximize its ROI on the data migration project. The organization will receive a higher quality migration while also reducing costs. Performing the assessment will also mitigate risks associated with the migration. There's less potential for project delays or overages, and you are less likely to experience any surprises during the course of the migration project. The migration project can also be completed in a shorter timeline if an assessment is performed. Additionally, some of the work from the assessment overlaps with the initial stages of the migration, such as getting access, data extraction, data analysis. Having most of those tasks completed prior to the start of the migration project allows for a high level of productivity as soon as the migration project starts. The assessment sort of lays the groundwork for the migration project. The last one that I want to call out is that no matter how complex the migration project may be, an assessment will allow for successful execution of the client's strategy. There may be multiple variables affecting the project across many different data sets. An assessment will dive into the details of each of these, make the appropriate recommendations, and simplify the process. So in conclusion, we'd recommend that no matter how familiar your organization is with the legacy data or the migration process, plan for an assessment. Many times an assessment is an overlooked activity and is performed too late or without the detail it deserves. Make the assessment part of the original project plans and build it into the early stages of the project. If you can perform it prior to kicking off the migration project, even better, as it will help refine scope. And ultimately, it will benefit your organization as you head down the migration path. That concludes our presentation today. We'll now move on to Q&A. Just want to remind everyone about the process for asking questions. The phone lines will remain muted. So if you have a question, please ask it by using the Q&A panel within the WebEx. We'll wait just a couple minutes to see for any questions to come in.
Thank you very much, Tyler and Kayvon. I do see a question that just came in. What is the typical timeline for an assessment? Is it about 2 weeks?
Sure, I can take that one. The timeline really, it depends on a few factors, such as how many systems are being assessed, what size are those systems, what are the goals of the assessment, what are the goals of the migration project, the goals of the organization. But typically I would say from start to finish, it's somewhere around 6 weeks plus or minus, depending on other factors and other variables affecting the assessment.
Excellent, thank you very much. And so we'll keep the lines open for any more questions for a couple minutes. But I do want to say to everyone who attended, thank you for attending. And if you have any questions, of course, feel free to contact any of us here at Galen at any point. Thank you.
So, Logan, I have a question here. Does Galen offer other types of assessments besides just data migrations?
So I can take that one, Tyler. So in addition to the data migration assessments, Galen does offer, just to name a few, assessments for EHR optimizations, PCMH or patient-centered medical home, patient reform, and operations. So if you're interested in finding out a little bit more about the other assessment services we provide, you can contact us either through our website or via email at sales@galenhealthcare.com.
Thank you for answering that one, Kayvon. At this point, I think I'm going to close this for questions, at least on this particular webcast. Obviously, our website does have a Contact Us page where you can ask us any questions that you have. Otherwise, feel free to reach out to any contacts that you already have here. Again, I'd like to thank Tyler and Kayvon for talking about assessments and how they can help in data migrations today. And with that, I will say thank you, everyone, and have a great weekend.